There's three separate ways really to treat reflux. One is antibiotic suppression. When it's diagnosed, you can give a small dose of an antibiotic every day to a child until they can actually grow out of the reflux. This is good in that it avoids any procedures, but it does expose the child to chronic antibiotic use, which can lead to resistant microorganisms within their urine. And they have to have periodic x-ray tests to see if the reflux has resolved or not. The second treatment is more definitive. It's an open surgery where you have to make an incision in the skin, take the ureter tubes, and actually tunnel them back into the bladder. This allows the urine to go into the bladder without refluxing back up. It's very definitive, as I said, but it also is without its own risks of bleeding, infection, and it's an inpatient stay, and there is pain associated with that. The third way to treat reflux we've done here at St. Jude is we're able to use what we call a copolymer. It's called Deflux, and it's a gel-like consistency, and it's able to be injected through a very small needle through a telescope we call a cystoscope. It's done in the operating room, and we're able to inject around the tubes that cause the reflux, and that bulking of the tubes itself allows the urine to go into the bladder and not reflux back up to the kidneys. New techniques of how to deliver the deflux has allowed us to cure those people in over 90% of the cases. And most of the cases that will recur can be resolved with a second injection sometime down the line. It's taken an inpatient open surgical procedure into a minimally invasive outpatient procedure with almost no risks or pain. This procedure really is the future. There are only a handful of physicians in the country doing this currently, and that number will probably continue to grow in the future.